They say cataract surgery is common.
Mm-hmm.
But did you know it's like the entire population of Australia getting a new lens every year? Wild.
Right. It's a lot of lenses.
This deep dive isn't about global stats, though.
Right.
It's about your recovery.
Yeah. Making that experience as smooth as possible.
Exactly.
A lot of times we get caught up in the surgery itself,
The main event.
but understanding the why behind those recovery instructions can really make all the difference.
That's like having a cheat code for healing.
Exactly.
So before we get to those tips, let's talk cataract surgery basics.
Of course.
What is it? What's the goal? That kind of thing.
Basically, cataract surgery is all about getting your clear vision back.
Okay.
Cataracts make the natural lens in your eye cloudy.
Right. Makes sense.
And this procedure just swaps out that cloudy lens for a new, clear, artificial one.
So it's not just about getting rid of the cloudiness. You're replacing the entire lens.
Exactly.
And understanding that is key for these recovery tips.
Knowing the why can really change how you approach it.
It's like that with anything, really.
Absolutely.
Okay, so let's dive into these need-to-know recovery tips.
Let's do it.
We found some real gems in our research.
Oh, yeah.
Like, I knew driving was a no-go right after surgery.
Right?
But I was surprised to learn you might even need sunglasses after you were cleared to drive.
Oh, absolutely.
Even on cloudy days.
Yeah, your eyes are going to be super sensitive to light after surgery.
Makes sense.
Think about like when you go to the eye doctor and they dilate your pupils.
Yeah.
Everything seems so bright.
So bright.
It's kind of similar to that those first few days.
It's like your eyes are getting used to a whole new world.
Exactly.
And speaking of taking it easy,
Yeah.
what about physical activity?
Mm-hmm.
What should people avoid beyond the obvious, like no marathon running?
Right, of course, of course.
But are there other things people should avoid?
Our sources mentioned bending over at the waist.
Really?
Yeah, like when your head's below your heart.
Huh. I never would have thought of that.
Yeah, it can actually increase the pressure in your eye.
Oh, wow. So even everyday things like, I don't know,
Yeah.
gardening or doing laundry.
Exactly, picking up toys.
All those things you might not even think about.
require a little extra care.
Exactly. Just think, bend at the knees instead of the waist.
Good to know. Okay, this next one I am so guilty of.
Uh-oh, what is it? Splashing water on my face.
Oh, yeah.
Apparently that's a big no-no after cataract surgery.
It's very tempting,
It is.
especially in the morning,
Especially in the morning.
to wake up.
Yes.
But you have to remember that incision site.
Right.
You don't want bacteria getting in there.
It's like a direct route
It is.
into your eye.
You want to avoid infection at all costs.
Okay, so gentle cleansing around the eye area
Yes.
for at least the first 24 hours.
At least.
Okay, what else?
This one might be a tough one for some.
Oh no, what is it?
Avoiding makeup
For how long?
for a couple of weeks after surgery.
I mean, it makes sense when you think about it.
It does.
You're getting up close and personal with your eye,
Exactly.
increases the risk of accidentally poking yourself, rubbing your eye.
Or even getting those products in your eye.
Ugh, yeah, no one wants to deal with an eye infection after surgery,
Definitely not.
especially not after surgery.
Think of it as like a little break for your skin, too.
That's true, a forced break.
Exactly. Plus, you can rock those stylish post-surgery sunglasses.
That's right. Protection and fashion, all in one.
Exactly.
Besides the don'ts, were there any surprising things we should be doing for a smooth recovery?
One of the biggest things our sources emphasized was using those medicated eye drops.
Okay.
Exactly as your doctor prescribes.
So important.
It's not just about comfort.
Oh.
They're really important for controlling inflammation and preventing infection.
So they're not just a suggestion.
No.
They're like mission critical,
Absolutely.
like taking your vitamins.
Exactly. Gotta stay consistent.
Speaking of consistent, let's talk about those first few hours and days after surgery.
Okay, yeah.
What can people expect? So walk us through those first few days.
Okay, sure.
What's normal to experience and what should send those alarm bells ringing?
So first off, blurriness right after surgery. Totally normal.
Okay, good to know.
Your eyes need some time to adjust.
Makes sense.
Remember we were talking about your pupils dilating?
Yeah, like at the eye doctor.
Exactly. Well, that happens during the procedure, too.
Oh, so it's not necessarily a sign that something's wrong?
No, not at all.
Just part of the process?
Exactly. And those medicated eye drops we talked about,
Right.
those can also make things seem a little blurry.
So just another reason not to rub your eyes.
Absolutely. Resist that urge.
Okay, noted. What about other sensations, though? Our research mentioned, like a gritty or scratchy feeling.
Yeah, That's totally normal, too.
Doesn't sound very pleasant, though.
I know, not the best feeling.
Tiffy.
But it should go away pretty quickly.
Okay, that's good.
Think about it. A tiny instrument was just working inside your eye.
True. I guess it makes sense to be a little irritated.
Right, like a tiny scratch on your skin, a little rough at first, but it heals fast.
That's a good way to put it.
And speaking of protecting your eyes,
Yeah.
those eye shields they give you?
Right, for sleeping.
Yeah, those are key for protecting your eyes, especially while you're sleeping.
Because you could accidentally rub them in your sleep.
Exactly. When you're not fully in control of your movements.
It's like in those medical dramas.
Right.
When the patient wakes up disoriented and tries to pull out their IV.
Exactly. Sometimes we need a little help protecting ourselves from ourselves, right?
That's a good point. But while some side effects are totally normal, there are definitely some red flags to watch out for.
Absolutely. And if you experience any of these, call your doctor right away.
Okay, so first up.
A sudden decrease in vision.
Oh, wow. Okay, yeah, that's serious.
Yeah, or even a complete loss of vision. That's definitely a call your doctor immediately situation.
Definitely don't wait and see on that one.
Exactly.
Okay, what else?
Severe eye pain.
Like more than you can handle with over-the-counter painkillers.
Right. If those aren't touching the pain, something could be wrong.
Okay, and what about redness or discharge?
So a little bit of redness or discharge, especially in the first day or two, that can be normal.
But when should you be concerned?
If the redness is severe or if the discharge is thick, yellow, or green, that could be a sign of infection.
Okay, so no self-treating with old eye drops.
Definitely not. Those could actually do more harm than good.
Better safe than sorry.
Exactly. You know your body best, so if something feels off, trust your gut and call your doctor.
Love that. You are your own best advocate.
Oh,
So let's talk recovery timeline.
okay, yeah.
Our research says that most people start to see improvement within a few days,
That's right.
but it can take a few weeks for your vision to fully stabilize.
It's really important to set realistic expectations.
So it's a journey, not a quick fix.
Exactly. Think of it like, you get a software update on your phone.
Okay,
It takes a little bit of time for everything to run smoothly.
I like that analogy.
It's not instant.
So what can people realistically expect in those first few days and weeks?
So within the first few days after surgery, you should be able to see well enough for most everyday activities.
Like reading or watching TV?
Exactly.
Sure.
Things might still seem a little blurry or hazy, though, especially finer details.
Got it. So you can see the TD screen, but you might have to squint to read the subtitles.
Exactly. But that should improve pretty quickly.
Okay.
By the end of the first week or two, most people are seeing pretty clearly at most distances.
That's good to hear.
It can take a few weeks for everything to fully settle, though.
For your brain to catch up to your new lenses.
Exactly.
Now, our research mentioned a potential complication called posterior capsule opacification.
Right, PCO.
Sounds kind of intimidating, to be honest.
It does sound scary, but it's really not as bad as it sounds.
Okay, good to know.
Basically, it's when the capsule that holds your new lens in place gets a little cloudy.
So not the new lens itself, but something behind it.
Exactly. Think of it like when you clean a window, you have that sparkling, clean glass,
Right.
but then dust settles on the screen behind it.
Annoying, but an easy fix.
Exactly. And luckily, PCO is usually a pretty easy fix, too.
How so?
They use a laser.
Oh, wow.
Yeah, it's a quick and painless procedure called a YA laser capsulotomy.
So even if this complication comes up, it's not the end of the world.
Not at all, and it's actually pretty rare.
Good to know. So those follow-up appointments with your doctor,
So important.
they can catch any potential issues early on.
Exactly, when they're easiest to treat.
Which brings us to prepping for surgery.
Okay.
It's more than just showing up that day.
Right. There are definitely a few things you can do beforehand to help things go smoothly.
Like what?
Well, for example, you might have to stop taking certain medications before the surgery.
Oh, yeah, that was in our research.
Yeah, it's important to talk to your doctor about all the medications you're taking.
Blood thinners, for example,
Exactly. You might need to pause those for a bit.
to minimize bleeding.
Right.
Makes sense. What other preparations do people tend to forget about?
Arranging a ride home.
Oh, right. Even if you feel fine after surgery, you shouldn't drive.
Exactly. You'll be surprised how many people forget this one.
It's like having a designated driver, but for your eyes.
Exactly. And while you're at it, might as well have him pick up some groceries for you.
Well, that's a good idea.
Yeah, easy to prepare meals and snacks.
So you don't have to worry about cooking while you're recovering?
Exactly. You can just focus on resting and relaxing.
Love it. We've covered a lot of ground here.
Oh.
From what to expect those first few days after surgery
It's a lot to take in.
to those potential side effects
And those red flags.
and how to prepare beforehand.
It's all about giving you the knowledge you need to feel confident and in control throughout this journey.
I love that. So to sum it all up,
Cataract surgery is a journey.
not a one-time event. It's easy to think, okay, surgery done, I'm good to go.
Right, like it's a one and done kind of thing.
Exactly, but you're saying it's more like starting a new chapter.
Yeah, I like that. A new chapter for your vision.
So cataract surgery is incredibly effective,
It really is.
but it's not a free pass to start neglecting your eye health.
Definitely not. Your eyes are part of your body.
Right, they need regular care, just like everything else.
Exactly, and that means regular checkups with your eye doctor,
Even if everything seems fine.
especially if everything seems fine.
Okay, so how can our listener be proactive about their eye health after surgery?
Ask questions, don't be shy.
What kinds of questions?
Anything that comes to mind, even if you think it's silly, like,
Heckler.
are there specific eye drops I should be using for lubrication?
Makes sense.
Should I be wearing sunglasses more often?
Oh, good one.
What about the lighting in my house? Is there anything I can adjust there?
Practical questions to protect that new vision.
Exactly, and your doctor can tailor the answers to your specific needs.
I love that it's all about staying informed and taking control of your eye health.
Couldn't have said it better myself.
Well, this has been incredibly insightful. Thank you so much for joining us today.
It was my pleasure. Thanks for having me.
For our listeners, remember, cataract surgery can be life-changing,
It really can.
but it's just one step on the journey of good eye health.
Many chapters to come.
Absolutely. So stay informed, stay proactive, and that's it for this deep dive.
See you next time.
We'll catch you on the next episode, ready to explore a whole new topic.